Hello everyone, this is Dr. Bice here to talk to you about the influence of culture on health and disease. I know as registered nurses you have probably been educated on transcultural health or cultural competency in every course that you have had in nursing or in grad school. I understand that, and I understand how you probably have a pretty decent grasp on how to be accepting and how to be culturally competent. However, cultural competence includes more than just being respectful of another person's values, beliefs, and morals and traditions. It includes a responsibility to understand risks, to understand needed extra types of prevention, to understand additional types of interventions, and to simply have just a basic understanding of a foundation for races, various cultures, traditions, etc., that will affect how you manage a patient's disease or wellness, and also how the patient will manage their self-care. So I'm not going to spend a giant amount of time on this, but I wanted to talk just a little bit about basic information that you should be aware of with regard to some races or, again, different cultures that will affect how you manage these patients' diseases. So one of the first things I wanted to go over is SDOH. I am sure you guys have heard of social determinants of health. This is a real thing, okay? So you hear all the time, oh, where people live affects their health, where people, go to school affects their health, what their neighborhood looks like affects their health. But I'm not so sure that everybody really understands the gravity of that until sometimes we're seeing social determinants of health really lead a patient down such a poor path of disease and, even death. So it's your responsibility as a future advanced nurse practitioner to know what social determinants of health are and to know how that will affect every patient that you see. So with regard to children, the major factors that are included in the social determinants of health are healthcare. Okay, so healthcare includes access to healthcare, not just can the patient go to the emergency room when they are sick, but is this child getting every well visit that they should have? Are they coming in every time they are sick when it's necessary? Are they having their growth monitored and their development monitored the way that they should as a child because of all of them regular and important changes that occur from birth onto adolescence and then adulthood? Okay, neighborhood and environment. This has actually been shown in quite a bit of evidence in literature to be super significant. Okay, where a child lives, the type of community, what exists in the environment for that child to help them grow is essential. I know that many of you have heard the statement, it takes a village to raise a child. That is really a true statement for many different cultures. Okay, so where some children may grow up in an area where there is only 5 people in their neighborhood, other children may grow up in an area that in a 10-mile radius there's 6,000 children. Okay, so what I'm trying to say is access to resources in a neighborhood and an environment and how that child is able to access those resources is essential in how they will grow. Next, social and community context. Okay, so another really essential thing. What is the level of community that that child is exposed to? How social are they? Are they engaged with other kids? Are they engaged in a community? The way that I go to church on certain Wednesdays and Sunday nights, or I also go to a book club and I have access to that community and people who are supportive to me in that social way. What type of access do the kids that you're caring for have with regard to social and community context? Okay, economic stability. That's a no-brainer, of course. How much money a parent has or caregiver has is certainly directly related to the health of their children. And that's sad, but so true. So not that I'm saying that you have to ask every patient's caregiver that you see, how much money do you make? That's definitely not what I'm saying. But whether or not that child has financially stable home, an economically stable home will certainly affect the child's health and, well-being. So remember that when you're dealing with patients who are below the poverty line, who are, middle class, upper class, knowing that is important and essential to knowing how your patients will receive care and how they will obtain care, have access to care, and how they will deal with the care that you provide. Okay, for example, one of my very biggest pet peeves, if you have a child who is on Medicaid and it is something that is pretty apparent that the caregivers may not be able to afford an expensive medication, but you are prescribing a medication that is not only off-label, but maybe $167 for an antibiotic, what is the likelihood that that caregiver will be able to afford to go fill that medication to give their child? When you are a parent who has to make the decision of, do I buy groceries this week, or do I get my child this ear infection medication? That's a difficult decision to make, guys. But many caregivers have to make it. So when you are prescribing and you are providing treatment plans and you are educating, think about the things that your patient will actually be able to accomplish. Work with them to develop a plan of care that is something that they can follow and that's something that they can willingly adhere to that will not affect other areas of their life. And then last one, of course, education. Okay, I'm not talking about, how smart is the mom and dad. I'm talking about whether or not a parent has a high school, college, higher education degree will affect a child's health. So it's important for you to understand that it should affect how you manage, it should affect how you educate, and it should affect how you collaborate and build rapport with your patients. All right. So let's talk just a little bit about different races, traditions, cultures, and how that may affect disease. Okay, so children of African American descent. Okay, now that's a pretty broad term. When you're considering African American, there are many countries in Africa. There are many children who live in the United States who are African American, but it's important for you to understand there are certain diseases that are more common in an African American child than other children. So for example, sickle cell trait, sickle cell disease, okay, that is a disease that is seen in African American children. And you must be aware of family risks, health risks that relate to the race of being African American. It's essential that you understand also that the risk of those diseases such as obesity, high blood pressure, high cholesterol, okay, and then also diabetes are increased among African American kids. So if you understand what those diseases that these kids are at risk for, then you can help to prevent those and help to provide good education as they grow from infancy on into adolescence. Next. So Asian children. Okay, again, these are, some of them are clumped quite big, but I'm using the Department of Health and Human Services race description because that's one of the most appropriate ways for me to describe this to you. But one example of a disease that is more common in children who are Asian is Kawasaki's disease. Okay, so Kawasaki disease is an autoimmune condition that is common in children who are between the ages of about 2 and 4, usually actually 15 months and 4 years old. It's very uncommonly seen after that age. But we know that it is more common in children who are of Asian and Pacific Islander descent. So, where that may be pertinent to you is if you have a child who comes in to see you with sore throat, cervical lymphadenopathy, and a strawberry tongue, one of the things that you would be considering automatically is strep pharyngitis. One of the things you would be considering automatically is probably Kawasaki's disease in your differential. But your differential list would be pushed up higher for Kawasaki if that child comes in and is of Asian descent. So again, important to know culture and race, because when we know about what certain conditions and lifestyles and traditions are found in certain cultures and races, then we can understand also how to best manage those diseases. Other things that are very high in Asian populations: secondhand smoke in kids for children who are Asian, because there is a very high rate of smoking in Asian countries. Some other also European countries, but Asia has one of the highest rates of smoking, and their children are often exposed to that secondhand smoke. So it's something for you to consider, because we can provide really good education for smoking cessation in these parents, or at least education on how you can avoid smoking around your children. All right, let's see here. All right, so one of the other population groups that I wanted to talk to you about that really affects treatment and management in children is children who are from Middle Eastern countries, also specifically Mediterranean countries, so not necessarily all Middle East. Some of them are going to be European countries, some of them are going to be Asian countries, but children who are of Middle Eastern and also who are from Mediterranean countries experience a much higher rate of hemoglobinopathies. So when I'm talking about Mediterranean countries, I wouldn't necessarily expect you to know what a Mediterranean descent means, but quite simply, a child who is from a country that is considered Mediterranean would be a country that borders the Mediterranean Sea. Okay, there's many of these countries, but Italy, Greece, Croatia, Libya, Spain, all of these countries that border the Mediterranean Sea are much more likely to have a hemoglobinopathy than a child who is not from that descent. Now, these types of hemoglobinopathies that I'm talking to you about would be something like thalassemia, okay, alpha or beta thalassemia, and other types of hemoglobinopathies that are genetic traits or X-linked conditions. And the reason that's important is because you may see a child who is, here for a 5-year well visit, and you've done a CBC, and you're seeing that the child has a 10.0 hemoglobin and a mildly low hematocrit. And you're like, wow, that's odd. It's the first time I've ever seen this patient. They seem really healthy. Mom and dad's not telling me that they have any complaints. But one of the things you would be thinking about in your plan of care would be a hemoglobinopathy, maybe related to the fact that they are more at risk because of their descent, their ethnic background, their culture, their traditions, and simply where they grew up. That is essential for you to understand as well. Additional things that are more common in Middle Eastern and Mediterranean descent is going to be smoking again. Just like we were talking about with the Asian population, smoking is also very high in the Middle East, and so smoking exposure or secondhand exposure in children is high as well. All right. So Pacific Islander children, children who are from Pacific Islands, so that would be Hawaii and other Pacific Islands. One of the biggest things that is of concern to children who are from Pacific Island countries is obesity and diabetes. That is the same and very similar for children who are of Native American, descent. And that's essential to remember, because when you have children who are at much higher risk, regardless of other factors for diabetes, high blood pressure, and obesity, like these two groups of children, then that is a big responsibility for you to provide lots of education on the prevention of those conditions. All right. Let's see here. I think I already got that one. Hispanic children. Very similar to Pacific Islander and African American children, with a high rate of diabetes and obesity. However, children who are of Hispanic descent and then as they grow to adulthood are at much higher rate of death from diabetes. So diabetes prevention and obesity prevention is key. Please remember, as you're moving through your education about culture, to remember how different races will affect a child's health.